For 9 devastating months, the world has been watching a relentless humanitarian crisis unfold in Gaza. The conflict that began on October 7th with Israel's military campaign to eliminate Hamas has led to unimaginable suffering for countless innocent people caught in the middle. Over 40,000 lives have been lost, and the toll continues to rise as the violence drags on. Families are torn apart, communities are shattered, and the hope for peace feels more distant than ever. The situation in the West Bank has taken a devastating turn, with Israeli forces launching their largest assault in over 2 decades. The attack, which began on Wednesday, has left a path of destruction and despair, with at least 18 lives lost, according to Palestinian sources, and many more injured or detained, including children. The violence has hit areas like Jenin, Tulkarem, and the Farah refugee camp especially hard. Since October 7th, the death toll has surpassed 600 in the West Bank region. This brutality has far-reaching consequences and has sparked a new wave of resistance in the region, including the recent suicide attack in Tel Aviv. A new and alarming development has emerged in Gaza, a polio outbreak. The already devastated region, reeling from 9 months of relentless violence, is now facing a fresh threat to its most vulnerable population, children. Before the war, Gaza boasted 100% polio vaccination coverage. However, the ongoing violence has crippled healthcare infrastructure, causing vaccination rates to plummet to 80%. This drop is particularly alarming, as the World Health Organization, WHO, emphasizes that a minimum of 95% vaccination coverage is crucial to prevent the spread of polio. Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, WHO, has sounded the alarm on the escalating polio crisis in Gaza, cautioning that it's only a matter of time before thousands of Palestinian children fall victim to this preventable disease. His stark warning underscores the urgency of the situation, as the conflict's disruption of healthcare services and vaccination efforts has created a perfect storm for the virus's spread. The World Health Organization, WHO, has launched a massive vaccination effort in Gaza, dispatching 1.2 million doses to immunize 640,000 children against polio. However, maintaining the delicate cold chain needed to keep the vaccine viable poses a significant hurdle. The vaccinations must be stored between 2 to 8 degrees Celsius. Above this temperature, they are rendered ineffective. The WHO has joined forces with other organizations, including the United Nations Children's Fund, the UN Relief and Works Agency for Palestine Refugees, UNRWA, and the Palestinian Ministry of Health, to ensure the success of this critical mission. Together, they have issued a heartfelt appeal for a polio pause, a cessation of hostilities in Gaza, to facilitate the vaccination campaign. The European Union has added its voice to the growing chorus of international appeals for an immediate truce in Gaza, urging all parties to cease hostilities and allow for a humanitarian pause to combat the spread of polio. EU High Representative Josep Borrell emphasized the imperative need for a temporary cessation of violence, stressing that the already war-torn Palestinian population cannot afford the added burden of a preventable disease outbreak. The polio outbreak in Gaza is merely the tip of the iceberg, as the region grapples with a broader public health crisis. According to the United Nations Relief and Works Agency for Palestine Refugees, a staggering 40,000 people have tested positive for Hepatitis A, a highly contagious liver disease. This alarming surge has come in the wake of the destruction of Gaza's water and sanitation infrastructure, leaving hundreds of thousands without access to safe drinking water. The number of people affected by acute jaundice syndrome has soared to over 100,000 since October 7, 2023. Things took a severe downturn in January 2024, when the number of diarrhea cases surged by 50% in just 1 week. During the period from November 29th to December 10th, cases of diarrhea among children under 5 spiked by 66%, with a reported 59,895 cases. More than 300 deadly cases of meningitis have also been reported. According to the World Health Organization, WHO, over 150,000 people in Gaza have developed skin diseases as a result of the dire living conditions they have faced since the onset of Israel's war. The scale of the crisis is staggering, with reports of 96,417 cases of scabies and lice, 9,274 cases of chickenpox, 60,130 cases of skin rashes, and 10,038 cases of impetigo since the conflict began. More than 54,866 cases of upper respiratory tract infections have been diagnosed. Escalating the crisis further, numerous Western nations have slashed their funding for UNRWA, which has long been a crucial lifeline for Gaza's 2 million refugees. This decision comes in response to allegations made by Israeli officials. In 2022, before the conflict, the UN agency received substantial support, including $343 million from the United States, $202 million from Germany, and $114.2 million from the European Union. Now all three have withdrawn their funding, leaving the besieged people of Gaza without vital assistance. UNRWA isn't the only organization struggling to provide aid. Several others have also faced significant challenges in managing relief efforts in Palestine. In April 2024, 7 workers from World Central Kitchen lost their lives, leading the organization to halt its operations in Gaza. Recently, UN officials stated that Israel is significantly obstructing aid organizations working in Palestinian territories, severely disrupting relief efforts. On Monday, a UN representative mentioned that nearly all aid operations in Gaza had to be suspended following a new series of extensive evacuation orders from Israel. Then on Wednesday, the UN's World Food Program announced it would temporarily stop staff travel in Gaza after one of its vehicles was attacked near an Israeli checkpoint. Meanwhile, the United States, a key ally of Israel and the largest funder of the UN, has remained conspicuously silent on these developments. This silence has fueled frustration and resentment among humanitarian organizations operating on the ground in Gaza. A report from Refugees International claims that Israel is deliberately creating conditions similar to famine by blocking any aid from entering the Gaza Strip. The report describes the situation in Gaza as utterly catastrophic, accusing Israel of repeatedly and unjustifiably obstructing aid efforts within Gaza. As diseases and casualties mount, Gaza's healthcare system continues to lose functionality. Presently, only 16 out of 36 hospitals are operating, but at a reduced capacity. The devastating consequences of the conflict are compounded by the destruction of critical infrastructure, including sewage pipes, with a staggering 70% rendered inoperable. Due to severe bombing, the sewage infrastructure is completely damaged, and the sewage water sometimes takes the shape of floods, inundating homes and streets with toxic waste. This has created a toxic environment ripe for the spread of disease. Doctors and medical staff are overwhelmed, struggling to cope with the sheer volume of patients suffering from pneumonia, chest infections, diarrhea, and other waterborne diseases. The root cause of this crisis is the lack of access to clean drinking water, with the population forced to rely on contaminated sources. In a dire illustration of the situation, residents in camps are resorting to dumping sewage into nearby water bodies, which are then used for drinking, cooking, and hygiene. The inactivation of Gaza's water treatment plants has created a perfect storm of disease and desperation, with the most vulnerable paying the highest price. The situation in Gaza is nothing short of a catastrophe. Those who aren't dying from the relentless bombing are falling victim to dangerous diseases, trapped in an environment where survival is a daily battle.